Hello, hello, hello. This is Truth Be Told. I'm Dr. Walter Aka.
And I'm Dr. Leroy Horton.
And, so we are coming on here real quick just to tell to everybody, we've gotten some great feedback from our previous episodes. And so what we're trying to do, Dr. Horton and I got together and we said, hey, let's formally introduce ourselves and talk about how we can make this podcast exactly what we want. So he's going to talk about basically what got him into the podcast, why he basically chose to help me out by coming on the podcast and providing his knowledge. So, Dr. Horton, please.
Yeah, so basically what you're getting is you're getting two dental nerds. All right. I'm a self-professed nerd and Dr. Aka is as well. That's kind of how we met, and then a friendship bloomed from that. And we've just had a blast, whether it's hanging out in person, whether it's doing these podcasts. We talk dentistry, we talk life, we talk philosophy, we talk science. And so what we really want to do is engage some of our listeners who have expressed a great amount of interest and a great amount of entertainment that they're getting out of me and Walter talking. And so we want to continue that and harvest it in a way that's tailored to what you guys want to hear.
Right. And for me, I'm just grateful that, anybody's listening, to be honest, And so for us, I want to basically enhance that. Have people ask us questions if you can and you don't mind. Right? Everybody says this on YouTube, so I'm going to say the same thing. I want you to subscribe. I want you to like. I want you to, turn on that notification so that we may be able to let you know when the next episode is coming. We want you guys to interact with us. Right. And in the end, we want to answer any questions you may have. If it's a dental related questions, great. Right. If you can, the more information you can provide us, the better we can help you. Right. But again, one thing we always say is this is not the final end all be all. This is our opinion. We're trying to provide you our opinion. The best thing to do is see your dentist, see your provider, but we want you to be able to be knowledgeable when you go see their provider. If you don't agree with something, just think of it as like a second, third, fourth opinion. Right? Get your opinion from us. Ask us questions. We'll be honest because we have no stake in the game. You're not paying us. This is a free consultation if you think about it.
Unless you want to pay us.
Well, there you go.
I'll take it, right?
Exactly. But in the end, we want to make sure that we are helping you guys. You guys are the people that are continuing this with us, this journey with us. We want to help you in any possible way we can. So send us voice recording, send us an email, send us a video. I want to see your pretty faces. We want to know who we're dealing with, and we want to know how we can help you in any possible way.
And these questions, don't be scared. Ask the hard-hitting questions. We'll take all questions, but if you come to us with an elementary question like, Dr. Horton, Dr. Aka, why did you choose perio? We'll answer it, but you've got a platform. We're giving you a platform. Do something more with it. Come to us and say, Dr. Aka, how old were you when you started losing your hair? Now that's that's a hard-hitting question, right? What's it like working with a co-host that's so devastatingly handsome? Make him be vulnerable.
I'm not gonna lie, I'll probably cry first, and I may not answer that one because I'm offended. No, that's actually an incredible question, and that's the whole point of this. We want to have fun. We want to have fun with this. Dentistry doesn't have to be so serious. We don't have to answer all the. You can, like you said, you can ask us anything. We'll answer it. You know Absolutely. What I mean? One thing we want to do is be vulnerable. We want to make sure that you guys get to meet us and introduce us to you guys. We want to get to know everybody, and just let's have fun. Let's have fun with it. And so that's why we're doing this. And we thank you guys so much for this opportunity to, be in your face. You don't have to listen to us, but you choose to. You don't have to watch us, but you choose to. So we thank you so much for that.
We appreciate that.
No, absolutely. One thing we want to do real quick, and Dr. Horton doesn't know anything about this, but I want to just do one quick little fun fact, one little quick little evaluation of a case that I saw that was sent to me. And I thought, I want to get your opinion. Opinion. So I'm going to go ahead. I'm going to go ahead and just share this screen, and I want you to listen and watch, and then tell me what you think, please. You'll see. You'll see.
Uh-oh. It's not a video of me, is it?
Not close, but it's all good.
Stavo chiuso fuori, non li prendo a calci sti bottoni, sguardo in alto tipo scalatori, quindi scusa mamma se sono sempre fuori, ma sono fuori di testa.
so clearly,
Hmm.
so clearly this patient is very happy
Very.
with the results.
Yes.
But if I have to be honest, I don't know if the results are great. Speaking from a dental point of view.
Right.
So please, I want you to let me know what you're seeing, because I know what I'm seeing. I know what I'm
Right.
seeing, but I want you to let you know. I want you to let me know what you're seeing and what we could do to maybe change that final product just a little bit.
Well, I'll be honest with you. I think you hit the nail on the head with that first statement. The patient's happy,
That's it.
right? And I'll wholeheartedly tell you, I've had cases where they're anterior aesthetic cases or they're full arch implant cases. The patient wanted an A1. And, you
That's
know,
like toilet bowl color.
yes. And let's
It's
be
like
honest,
white. Yeah.
not everyone has, I don't know how else to say it. Not everyone has an A1 face, and not as in judging as in the faces,
Right.
but if you're
Right.
older, if you got some, some aged definitions in your skin, you got some wrinkles, you got some gray hair, having complete porcelain white teeth, they stand out. To me, what I would look for is something that looks natural, right? Like you said, and to steal your phrase, is my job is to make it look that I wasn't even there.
Right.
And so when you see someone that has teeth that look like they had work done, as a dentist, I critique that and I say, okay, maybe that's not the ideal as I perceive it. But when you see the patient happy and ecstatic, it's hard to argue with that,
Right.
right? But
Right.
my overall question when it comes to, I think that was taking place in what, Turkey?
You're right. Yeah. This
Um,
is something apparently is like a new fad where everybody's going to Turkey. And listen,
yeah,
I do not hate on people going to get less treatment done at a cheaper cost. We've become expensive in the US, I'll be honest, right? So if you can
right,
find somebody who can do an equally good job, I say that to my patient all the time, go. That's
yeah,
okay. That is okay. I cannot do an implant for $400. I can't do it. It costs me about that just to buy the implant.
right.
Right. And I have to pay people and go through all that process. So by all means, please go if it's cheaper. But the key is we want quality still.
And is it cheaper? Because I think about you're paying for the trip,
Right. The flight now, it's expensive.
potentially a hotel. You're
Right.
paying for the treatment at a reduced cost. You especially if it's a larger treatment, there might be follow-up. So I'm thinking either you're staying a long time or you're doing multiple trips, which to me I feel like it starts adding up. And then you don't have any recourse. What if something chips? What if something needs to be addressed or you have a complication? It's nice to be able to drive 15, 20 minutes to see your provider versus having to hop on a plane and travel hours and spend thousands of dollars. So I've never quite understood, but you're right. It's a fad of, especially Turkey. I mean, they're doing full mouth reconstructions. They're doing hair transplants. Well,
I'm not
okay.
doing it. I've given up. Jordan was my hero.
No,
I stick
listen,
to
I
that.
like the look. It's
I
sleek.
stick- I stick to that.
Yeah. So
This
if
has already
anybody's
happened. It'll
if
look weird.
anybody's thinking I'm giving him too much of a hard time, I love Walt. He's a brother from another mother,
For
so
sure.
I
For sure.
I talk a lot of mess. But yeah, as far as the tourism, if he's happy, God bless him. I'm not going to judge him.
That's it.
But at the end of the day, I have had my own patients that they absolutely wanted something that I didn't necessarily think looked good.
Right.
But my job is not to give them what I think looks good necessarily. I have to meet their standards and their desires as well.
Right. And one thing that I will say that I noticed was, whenever he closed his teeth, and let me see if I can get this right. His teeth, the front teeth never came together.
Right.
That's how it was before the procedure. That's how it is after. So they didn't correct for what we call the anterior open bite. They didn't correct for that. So that's something that maybe if you went through braces or had basically jaw surgery, that would have corrected for that. But maybe he didn't want to do that. But if from a dental point of view, that's the one thing that stood out big time to me was the fact that even after his procedure, even after all those crowns, he still can't bite into a sandwich completely.
Right.
And that's the part that bothered me. Did
You
I
know,
say,
that-
if he's happy, like you said, if he's happy, he's happy. I can't hate on that. But
Right.
if I had to do it, I would actually talk him into, let's close that. Let's go through braces. Let's go through the surgery to try to finish and completely give you what you want. Well, maybe that's what he wanted. But for me, what I want, which is to close
Right.
that anterior bite. You know what I mean?
Well, here's a good question for you.
Hmm.
Would you do something if you had informed a patient that this is the ideal,
Right.
but they say, Doc, I don't want the ideal, I just want this? Where do you draw your line on
Right.
doing stuff that you may not think is the best possible care because the patient is choosing not to get it?
Right. No, as long as it's not hurting the patient. Because remember, just like with any doctor, you choose not to do harm. Right. That's our
Mhm.
first oath. You do no harm. And so as long as it's not harming the patient, this is not harming the patient. Right.
Right.
This patient's not going to die from it or have complications that are intense that will cause harm. So it's not the case. Like he started with something, an open bite, and he's ended with an open bite. So nothing really changed except for he's
That's
got
true.
teeth that he's happy with.
Right.
So that's the one thing I would say, okay, fine. I'm not gonna, I may not post this on social media, but
Right.
but he will, and I'll be like, thank you. I appreciate the fact that you're happy. And if he says, Dr. Aki, you changed my life, that's great. I mean, I don't get that a lot because everything I usually do is underneath the gums or anything, so no one even knows that I was there.
Right.
Unless something
Right.
goes wrong. Then all of a
Right.
sudden, I'm the
Nah,
only one that did it.
Exactly.
It was all me. It was all me.
I'll be honest though, I cringed a little bit at the doctor not wearing any eye protection and being all up on the patient like this.
Yeah.
Yeah, I don't know why that stood out to me. I was like, wait a minute, you don't want no glasses?
So you have a lot of what he's saying. You have a lot of aerosol just going into your eye, you know,
Right.
and poor, just sitting still. Like you don't have any kind of like support for your back, your neck. This guy is gonna need some kind of work after some kind of massage therapist.
He's gonna get frozen neck like the last video that we did.
There you
right?
go. I didn't want to
He's
bring
gonna-
that up. I didn't want to bring that up because in the end we don't want to hate on anybody. You know?
Right.
But
Right.
but yes, I mean that's the case. But anyway, I just want to just throw it out there real quick. We
Yeah.
do appreciate you guys. We really do. Thank you for watching. And please, if you like this, share it, and ask
do.
questions. Please send it to us. And the best place to send it to us is Real Dentist with an S. So Real REAL Dentist DENTISTS at gmail.com. Real Dentist with an S at gmail.com. Just send it there. We'll get it. We'll basically show your, we'll answer your questions. And we hope to hear from you guys. Really do.
We do. And it doesn't have to be just clinical questions. It could be work-life balance. It could be business. It could be school, academia. Like it can run the gambit of all topics. We like discussing science, philosophy of everything dentistry.
Right.
And so, yeah, please send those in.
And we'll find people, if we can't answer it, we'll find somebody that can come on and answer it for you. It's not just going to be us. If it's a pediatric question and I don't know, I promise you I'll find a pediatric dentist that can answer it. Whatever it may be, we'll find somebody that will answer it honestly and will answer it factually so that you don't leave going, what the heck were these guys talking about? We don't want to look bad. We're too pretty for that,
And I promise I'm going to work on getting a better background because you've got this whole cultural, I've got books in the background, so I'm well read. I look like I'm broadcasting from a jail cell. Right?
I will say this is all the wife. She did all
Okay.
She did all this. You can clearly tell where she put like kids and stuff, so that I look like I actually, have a family and I care and all this, which I do. But this is not me. This was me. This was me.
That was you.
I did that. That was me. I want everybody to know that was me right there, and everything else, forget that. All that. This is me. Focus on me. You know what I mean? But no, I definitely appreciate you, man. Thank you so much for taking the time, man. We'll talk soon.
Sounds good.